Good morning, everyone. Let's start our second day with a prayer. Let's put ourselves in the presence of our Lord. Loving Heavenly Father, eternal God, I pray that you bless us in this event as we continue on our second day and keep us. Lord, make your face shine on us and be gracious to us. I pray that we feel your presence during this event because you are with us wherever we go. I pray this event focuses upon you and your plans for us as a body of believers. Our prayer today is that your will be done through this event. Take what we have prepared and multiply our efforts as only you can. Bless all the speakers and the people behind this event. Steer our intentions to align with your righteous will. Blanket us with your peace today, Father. Keep us physically safe and guard our hearts and minds from pride and selfishness. Keep love at the forefront of our minds today and the guiding light for all we set out to accomplish and celebrate. Amen.
Okay. Good morning, ISSUP Philippines, and good day and good evening to all our friends from across the globe. I am Chit Castillo, the Chair and President of ISSUP Philippine Chapter. ISSUP Philippines, with the support from the Bureau of International Narcotics and Law Enforcement Affairs, or INL, U.S. Embassy Manila, and in partnership with the Dangerous Drugs Board, warmly welcomes you to day 2 of our very first major virtual event for 2021. We're jump-starting the year with this event with a hope to build interest and engagement among us professionals and practitioners in the field of addiction and behavioral health to join the ISSUP Philippines second national conference in June 2021. So the world is in the midst of a most severe crisis in our time. The coronavirus pandemic has changed the landscape of everything around us. It's global in scale and massive in impact. The problem of addiction and mental health has taken an unprecedented surge. As a network of prevention, treatment, and recovery professionals, we are committed to continue to provide quality of care to people and communities that we serve. Awareness, knowledge, and understanding of these new challenges are key to better equip ourselves to respond with positive attitudes and evidence-based practices. Thus, our conference theme, Emerging Issues and Realities on Addiction and Behavioral Health Amidst the Pandemic, the Silver Linings of the Lockdown. Yesterday, day 1, we were very privileged to have with us a powerhouse panel of speakers in the drug demand reduction field from different parts of the world. Today, day 2, we will hear from our very own national experts from the different departments and agencies who will each present the emerging realities and issues of addiction amidst the pandemic in the context of their own charters or mandates. We all know that the Philippines has long been a subject or a target of criticisms in its long-running program of war on drugs. You have Operation Tokhang, EJK, or the extrajudicial killings, or naglaban. We are or like the new normal. However, we do know too a lot about very positive initiatives like community-based rehab programs being done by some government agencies, and that will also be very timely to present in this forum. So brace yourselves for another very informative and substantive session for today. And please feel free to put your questions on the question box on the right side of your screen so you can collate and we will hopefully be able to answer all of them during the Q&A. Before we move on, let us get to know what ISSUP is all about. Sorry for those who've seen this, but for those joining us for the first time, here is a snippet of ISSUP's vision, mission, and goals. Video, please.
ISSUP is an international professional society that connects, unites, and shares knowledge across the global prevention, treatment, and recovery workforce. Substance and drug use disorder are major global problems. There is enormous unmet need for effective prevention, treatment, and recovery support worldwide. Across the world, clinicians, service managers, public health specialists, researchers, volunteers, families, communities, and civil society are working hard to help save, support, and improve lives through well-organized, effective, and ethical systems and services. Evidence-based prevention, treatment, and recovery programs and strategies offer huge benefits for individuals, communities, and society. However, there are many challenges and obstacles that stand in the way of providing effective practice. ISSUP is here to help. We connect. ISSUP members are plugged into a thriving professional network for sharing practical advice and knowledge across a wide range of themes and specializations. Our online community allows you to communicate with other members and share ideas, research, and resources. ISSUP is an international professional society that connects, unites, and shares knowledge across the global prevention, treatment, and recovery workforce. Substance and drug use disorder are major global problems. There is enormous unmet need for effective prevention, treatment, and recovery support worldwide. Across the world, clinicians, service managers, public health specialists,
Okay, sorry for that. That was cut. Maybe we can play that along again later on. Okay, that's usually the problem when we do all this virtual thing. It's sometimes a connectivity issue. But anyway, we have three words actually for ISSUP. It's connect, unite, and share. Allow me to introduce first who and what ISSUP Philippines is. ISSUP Philippines was born out of a common desire of Filipino addiction treatment professionals who have long been trained by Colombo Plan Drug Advisory Program through INL of the U.S. State Department to professionalize and unite the addiction prevention and treatment practice in the country. We are duly registered non-stock nonprofit organization with SEC since 2014. Our claim to fame was the very successful hosting of the first national conference in 2017 at Novotel Manila. And I'm sure most of you attended that conference. On August 5, 2020, barely 5 months ago, a new set of Board of Trustees and officers was elected. And as we transition to the new and next normal, ISSUP's strategic thrust to sustain our momentum are 3 R's. Okay. We have reinvent, restart, and revitalize. Later on during the break, we will share with you our journey together as ISSUP Philippines in the last 5 months. Aligned with ISSUP Global's vision and mission, ISSUP Philippines was able to craft its own VMV in a strategic planning session held last 2014, way back before ISSUP Global came into existence. Our vision is by 2025 for us to be a premier organization of helping professionals of diverse disciplines in the field of substance use and co-occurring disorders, prevention, treatment, and recovery. Our mission is to create a safe and nurturing platform and community for professionals committed to the highest ethical standards of practice in the field of SUD prevention, treatment, and recovery. We also provide access and training opportunities to different curriculums, UPC Universal Prevention Curriculum, Universal Treatment Curriculum, and the recovery curriculums. And of course, credentialing and certification. Also, to advocate for broad-based education and critical reforms that pave the way for professional excellence, and to be a center for research and development on substance use disorder prevention, treatment, and recovery studies in the Philippines. We have also identified our core values, which are the basis of our rules of engagement. We have one, passion for excellence. We wear our passion on our sleeve and never settle for mediocrity. Hindi pwede ang pwede na. Integrity, firm adherence to the code of ethics of ISSUP and our respective professions. As we say, what do you do when nobody is watching? And last is unity and diversity. We unite across all differences, mutual understanding and harmony among diverse groups. Thus, our tagline is, we're one in purpose, one in action. So for those who haven't registered yet as members of ISSUP Philippines, please do visit www.issup.net and go to the ISSUP Philippine chapter page. Thank you very much and enjoy the learnings for today.
Thank you very much, Chair and President of ISSUP Philippines, Chief Castillo. Good day, everyone. Susan Rivera here, member of the Board of Trustees of ISSUP Philippines in charge of corporate affairs. It really does give me great pleasure to introduce our distinguished lineup of speakers this morning who will provide a national perspective on our conference theme. Dangerous Drugs Board Under Secretary Benjamin Panganiban Reyes obtained his MA in Public Health from the University of the Philippines College of Public Health, specializing in biostatistics and epidemiology tracking, and master's degree in development management from the Asian Institute of Management. As commissioner, he represented the Philippines for the Global Center for Credentialing and Certification of Colombo Plan International. He is currently permanent member and undersecretary of the Dangerous Drugs Board, where he also chairs the Drug Demand Reduction Committee. He has headed many Philippine delegations to international conferences, seminars, and training programs, the latest of which was the 129th International Narcotics Control Board meeting, UN headquarters in Vienna, done online, and head of Philippine delegation for the Experts Seminar on Drug Addicts Recovery Supports in East Asia held in Japan. Usec Benji will be the first speaker in plenary shortly. Philippine Drug Enforcement Agency Director General Wilkins Villanueva obtained his master's degree in public administration at the Ateneo de Davao University Program for Development Managers at Asian Institute of Management and is presently taking his doctorate degree on forensic criminology. DG Villanueva is a prominent member of Philippine Military Academy's Marinal Class of '88. He is the 7th Director General of the Philippine Drug Enforcement Agency. His laudable accomplishments in the field of law enforcement for over 2 decades gained the trust of Philippines President Rodrigo Duterte. From being the junior officer of the Philippine Constabulary 10th Regional Special Action Force, where he started his colorful military career, he has had numerous notable assignments. Among his noteworthy assignments, or accomplishments rather, in the fight against illegal drugs is championing the Barangay Drug Clearing Program, which has become the main strategy of the government's war on drugs. Major drug hauls, and dismantling the first live clandestine laboratory in Davao, Philippines in 2004. DG Villanueva's thrust in PDEA is focused on massive and professional anti-drug campaigns, while strengthening PDEA's collaboration with other law enforcement agencies. DG Villanueva will be our second speaker in plenary shortly. DILG Undersecretary Rico Judge Janvier, or RJ Echiverri, is a graduate of the San Sebastian Recoletos College of Law, Manila, Juris Doctor Program, class of 2020. He is also a graduate of the Philippine Public Safety College, with a master's degree in public safety administration. He has served as public servant for over 20 years. As the Undersecretary of External and Legislative Affairs of the Department of the Interior and Local Government, or DILG, he is accountable for all anti-illegal drug initiatives. He has also been leading the programs on strengthening local anti-drug abuse councils, or ADACs. Among the programs he leads are the conduct of the ADAC performance audit, where local ADACs are audited for their functionality. The revisiting of anti-illegal drug policies in order to solidify guidelines for efficient and streamlined operations, and the drafting and coordination of the Anti-Drug Abuse Council bill, which was recently passed in the House of Representatives. Now before the Senate, it mandates the creation and institutionalization of anti-drug abuse councils in all provinces, cities, municipalities, and barangays nationwide. Usec RJ will be the third speaker in plenary. As we listen to our speakers, we urge you to post your comments and questions on the question box, and they will be addressed in the Q&A forum later. We now give the floor to Dangerous Drugs Board Under Secretary Benjamin Panganiban Reyes. Dr. Benji, please. Sir, we can't hear you. I think you're still muted.
Oh, sorry. Okay. I was saying thank you, Ate Susan, for that generous introduction. Good day, everyone, wherever you are in the world. First of all, I'd like to thank ISSUP Philippines for organizing this online conference to help us understand how the pandemic affected our respective anti-drug campaigns. I'll be discussing how the Philippines responded in line with the Philippine anti-illegal drug strategy. Can you already see my screen?
Yes, Doc Bench, we can see your screen. Thank you.
Okay, I'll just turn off my webcam now. Okay, so hello.
Yeah, Usec, you can actually turn on your webcam. It's fine. We want to see your face.
Okay.
Thank you.
Yun, okay. Just to introduce our agency, the Dangerous Drugs Board, the agency I represent, it is composed of 15 social development and security government agencies in the Philippines. It is the highest policy-making body on dangerous drugs matters, charged to oversee the implementation of the Philippine Anti-Illegal Drug Strategy, or PAD. So as you can see, the DILG, PDEA, the Department of Health, and the various agencies are members of the board. Now, please allow me to give you a brief background on how the country responded after learning of the pandemic. The community quarantine in the Philippines started last March 16, 2020, when President Rodrigo Roa Duterte declared the entire Luzon area, the northern part of the Philippines, under community quarantine because of the growing COVID pandemic. Basically, all movements are restricted, closure of non-essential businesses, setup of checkpoints nationwide, and suspension of school and work were done. And this was later extended to cover the entire country. And then later on, Republic Act 11469 was enacted by Congress to free up funds and enable the government to provide resources for social amelioration programs, some sort of a stimulus, as well as to procure the necessary logistics for the health sector with a budget of around $8 billion US. Currently, the majority of the country is under modified community quarantine, which allows movement subject to safety protocols. And as of January 25, we already have 514,000 who's been affected with COVID-19, no? And 476,000 already recovered. Unfortunately, 10,242 died. Now, during this period, I want to highlight major regulatory and enforcement accomplishments to curb the supply of drugs. Suffice it to say, unfortunately, the drug problem continued to hound the enforcement sector despite the pandemic. The succeeding slides will show some major buy-bust operations in the country despite COVID-19 pandemic and the lockdowns implemented nationwide. As you can see, the most recent being the seizure of a 30 kilogram of shabu worth $4.2 million apprehended during a buy-bust operation in the cities of Taguig and Parañaque in Metro Manila last October 14. In the month of May, we had two seizures. One was $500,000 worth of shabu in Bohol, which also included the arrest of a drug personality. The other was the seizure of marijuana worth around $12,000 in Kalinga, Apayao, northern part of Luzon. A drug personality was also arrested. And on June 4, 2020, 756 kilograms of shabu worth $105 million in Marilao, Bulacan was seized, no? The biggest in 2020. On the screen is the latest total quantity and volume of seized drugs by the Philippine Drug Enforcement Agency, the Philippine National Police, and the other enforcement agencies. Last October 15, the President ordered the destruction of all of these substances amounting to around $607.4 million. Now, the Philippines has 42,000 barangays or villages, no, and 80% or 34,336 of those barangays were affected by the drug problem way back in 2016. Now, as of August 31, 2020, more than half or 59%, 20,165 villages of previously affected barangays have already been cleared. And in the next 1.5 years, we plan to clear the remaining 14,171 barangays. Now, at this point, please allow me to share noteworthy demand reduction accomplishments also in line with PADS. Immediately after the announcement of the community quarantine period, the following initiatives were done to mitigate the spread of the disease. First is the immediate suspension of visitation privileges for inpatient facilities, which was later expanded to include suspension of admissions after having COVID cases inside rehab centers. Both patients and staff were infected. Likewise, all community-based program services provision were suspended nationwide. Electronic prescription for regulated and non-regulated medications were authorized for continued access to essential medications. A pilot study done by the Supreme Court allowed promulgation of services and hearing of cases online. We also adopted online platforms for interagency policy meetings and even for the provision of community-based programs. As mentioned by Eric of CADCA and Olivier of UNODC yesterday, persons who use drugs undergoing community-based programs were utilized to help community mobilization of logistics during the lockdown. In an effort to mitigate the effects of COVID-19, the Department of Health also mandated to strictly observe prevention protocols in all levels of treatment program services implemented in the country. This was later adopted by the Dangerous Drugs Board for a nationwide implementation. Capacity building activities utilize online platforms, which also allowed access to mental health services. The Supreme Court authorized early release of qualified persons deprived of liberty through the issuance as seen on the screen. The Department of Justice approved the interim rules on parole and executive clemency, which is part of the DOJ study for the release of prisoners on humanitarian consideration, wherein requirements for parole review and executive clemency are trimmed down to only include court certification of no pending case, court certification of no appeal, and records review so that immediate release can be processed. Persons deprived of liberty who are 65 years old and above, who have served at least 5 years of their sentence, or whose continued imprisonment is inimical to their health, became eligible for executive clemency to be granted by the President. The Department of Health also established the national hotline called Helpline 1550. It was launched during the UN's International Day on Drug Abuse and Illicit Trafficking, or IDDAIT, June 26, 2020. The helpline can be accessed for referral to support services and basic counseling needs on substance abuse. Networking with support organizations were also done to immediately facilitate online provision of services. Partners like faith-based organizations, the Narcotics Anonymous, provided accessible online services for persons who use drugs. The DDB supported and participated the following free webinars for service providers done in cooperation with the following partners as seen on screen. The same partners have helped DDB develop evidence-based policies and implement model programs and rights-based approaches, including the recently launched UN Human Rights Resolution for a cooperative response for persons deprived of liberty and persons who use drugs. Now, very quickly, I'd like to just flash on screen some of the policies developed with partners and adopted by the Dangerous Drugs Board during the pandemic. I would just like to highlight Board Regulation number 9, series of 2019, or the approval and adoption of a unified manual in the investigation and prosecution of dangerous drugs cases. So hopefully by the first quarter of this year, this manual will already be available for use of all the enforcement sectors. Now, all our board regulations can be accessed in our website, www.ddb.gov.ph, and we also have accounts on Twitter and Facebook. Now, in conclusion, COVID changed our traditional practices, and we should recognize that it will be with us for a long time. Strengthening online platforms for capacity building and service delivery is a must under the new normal. Sustaining the current linkages and cooperation with partners, organizations, to provide practical support to persons who use drugs is necessary for accessible services. There is also a need to continue to engage with local government units for the drug campaign. As you all know, the Philippines is considered a high-risk country for disasters now. Unfortunately, typhoons, volcano eruptions, earthquakes, and now the pandemic. So we are trying to address simultaneous concerns, and this stretches our resources, manpower, and logistics thinly, and causes us to prioritize current concerns. Now, the challenge is to keep the drug campaign as the top priority, or at least maybe one of the top concerns. Now, maintaining the drug campaign in the consciousness of Filipinos can help us lobby for more support and continue developing models that work for Filipinos. And with that, I thank you all for your attention. Thank you. Back to you, Ate Susan.
Thank you for that, Doc Benji. A very, very supportive partner of everyone present. Thank you so much for that wonderful presentation.
Thank
and
you.
now we
Thank you.
welcome our Director General of PDEA, Wilkins.
Congratulations to the International Society of Substance Use Prevention and Treatment Professionals, Philippines, headed by its chair, President, Ms. Teresita C. Castillo, for organizing the ISSUP Second National Conference. Our counterparts from the International Narcotics and Law Enforcement Affairs of the United States Embassy Manila, representatives from the Department of Health, Department of the Interior and Local Government, Dangerous Drugs Board, and the Philippine National Police. Esteemed colleagues from the private and public sectors, good morning. I would like to convey my appreciation to the International Society of Substance Use Prevention and Treatment Professional, or ISSUP, for inviting the Philippine Drug Enforcement Agency to be part of this second national conference. It is an honor to share with you the efforts of the government in combating the problem of illegal drugs. As the lead agency in the National Anti-Drug Campaign, the Philippine Drug Enforcement Agency has adopted a three-pronged approach or strategy: the supply reduction, the demand reduction, and the harm reduction program. Supply reduction aims to take illegal drugs away from the people through the conduct of anti-drug operations and arrest of drug target-listed personalities. Demand reduction is keeping people away from the illegal drugs through advocacy campaign activities, raising awareness on the ill effects of illegal drugs. And the harm reduction is aimed at mitigating the negative effects associated with drug use and help reintegrate drug offenders back to the society. These strategies are aligned with the Barangay Drug Clearing Program, or the BDCP, as PDEA's main framework in the National Anti-Drug Campaign. The Barangay Drug Clearing Program is a holistic and whole-of-nation approach in addressing drug problem by enlisting the participation of the local government units, government agencies, and various stakeholders of the National Anti-Drug Campaign. The BDCP also includes updating and monitoring of suspected drug personalities and implementing intervention programs to transform them to become responsible and productive members of our society. We have already cleared a total of 21,034 barangays as of December of last year. These barangays have reached drug-cleared status after issuance of certification by members of the Oversight Committee on Drug Clearing Program. The Oversight Committee is chaired by the Regional Director of PDEA, including the Regional Directors of the Department of Health, Department of Interior and Local Government, Philippine National Police, and the local government units, or their permanent representatives. COVID-19 pandemic poses a challenge to the PDEA in the war against illegal drugs. It is also our duty as public servants to make the most out of what we can do to curb illegal drug problem. Illegal drug groups may take advantage of the present situation, but we are not letting our guards down. It's business as usual in all our anti-drug operations and anti-drug related activities. As we intensify our anti-drug campaign, I've also strengthened the collaboration with our foreign counterparts through sharing of best practices and intelligence information. We have also forged agreements with different media partners to enhance our information and education efforts of what the government is doing to address the drug problem. We have also launched the Facebook page named Isumbong Mo kay Wilkins and Barangay PDEA. These platforms serves as our assurance to the public that their concerns about illegal drugs will be directly sent to me. This is one of PDEA's way of getting closer to the people. On my 18 years in drug law enforcement service, our past effort were primarily geared towards the elimination of dangerous drugs. But time and time again, we have failed. In this regard, that I would like to emphasize the importance of harm reduction program, which our past leaders failed to appreciate. Harm reduction program plays a vital role in our overall campaign against illegal drugs, as it brings back drug users, and now as we call them PWOODs, to the mainstream of our communities. If we can just stop all of them from using dangerous drugs, selling the same will definitely stop. Ladies and gentlemen, all of us here are major and important stakeholders. We have to put our hands together to finally put an end to this menace that destroys our children and our country. Help us realize a drug-resistant and self-policing communities and ensure a healthy future for our next generation. Mabuhay ang ISSUP, mabuhay tayong lahat.
Thank you very much. By the way, that was a recorded message from our Director General Wilkins of PDEA. And may I like to remind everybody to please write your questions on the chat box, which you will find on the side of your screen. And now, a very good friend also of ISSUP, a very strong supporter of our activities. We'd like to welcome Undersecretary of the DILG, RJ Echiverri. Take it away, sir.
Can you see me? Okay, can you see the screen?
Only the screen, but not you, sir. You have to
Okay,
turn on your mic.
That will do.
Okay.
Thank you. Okay. Thank you to our dearest President and Chair of the ISSUP Philippines chapter, Teresita Castillo, to my fellow guests and participants in the second day of the ISSUP pre-conference, and to my fellow public servants present here today. Good morning to all of you. It is my honor and privilege to speak to all of you today. I truly appreciate the title or theme, our pre-conference event, Issues and Realities of Addiction and Behavioral Health, National Perspective. The drug problem is a national problem, a pervasive problem all the way down to the grassroots. More importantly, it is a health problem, and the theme of our pre-conference underscores that reality. Specifically, the country is plagued more by the demand reduction aspect problem rather than the supply. When President Rudy Duterte assumed office in 2016, there were 1.8 million voluntary surrenderies, which the barangay, police, and our justice system were caught unaware and surprised of the phenomena that existed. After assessing the 1.8 million surrenderies, we learned that 90% of which are considered mild, while 10% are severe. The issue at hand is the fact that the 5 pillars of justice system really don't know how to treat and handle the 90% mild drug addict surrenderies. There is no clear program nor policy to address the mild drug addicts who are considered majority of the surrenderies. which are now required to be admitted in rehab hospitals, but however are only reserved for the 10% which are considered to be severe. In short, they are not supposed to go to a rehab center in the hospitals because it is only reserved for severe. And since they are mild, there's really no program to address them. Thus, the Interagency Committee Against Illegal Drugs, DDB, DILG, DOH, DSWD created the program to be implemented by local governments, the CBDRP program, or the Community-Based Drug Rehab Program and Reintegration, to be implemented by all local governments through the anti-drug abuse councils. The local government will play a huge role in this campaign, just like the example which President Rudy Duterte has done in Davao City, wherein the local government played more an active role together with the police and PDEA, thus making Davao City one of the safest city in the Philippines. The community-based drug rehab program and reintegration is essential to ensure on active rehab programs in the community. The DILG must assess, capacitate, and give awards to LGUs in implementing the policy. Thus, we created indicators to assure proper monitoring of the performance of all LGUs in making the CBDRP program functional. How do you... Next slide, please. The DOH, DILG, DDB, JMC, or Joint Memorandum Circular on Community-Based Drug Rehab Program underscores this fact that a whole-of-nation approach is really required. This is especially because of the nature of this drug menace as a health problem for all our people. It further incorporates a whole-of-community approach to ensure that there is a more thorough protection, education, and implementation efforts in the grassroots. More particularly noteworthy is the CBDRP program. Is a concrete response against the stigma of rehabilitation and reintegration of former drug users. The policy highlights are as follows. The JMC not only provides for specific manner of implementation, but mandates in clear and unequivocal terms what every LGU ought to do. Allow me to go through the functionality indicators, which ensures an objective, qualitative, and clear basis for measuring the performance of our LGUs. Indicator number 1 is self-explanatory. There must be a DOH certified CBDRP. This covers 2 levels of performance indicators. First, institution accreditation by the DOH, and hence second program plan in line with the national government measures and standards. Indicator number 2 requires satisfaction of these profiling and screening measures in order that we can provide the commensurate and necessary treatment for every kind of patient or persons who use drugs. This ensures effectiveness in response and treatment of specific persons, maximizing therefore our medical resources and manpower. Indicator number 3 allows the national government database to update local performances and ensure accountability amongst LGUs for our CBDRP efforts nationwide. The mechanisms is placed rely on the IEDIMRIS ADAC reporting system, which is accessible by the ADACs. The ADACs, or the Anti-Drug Abuse Councils, not only perform overseeing functions as regards the LGU CBDRP efforts and anti-drug efforts in general. Clearly, they contribute as well to our mechanism for ensuring accountability in the LGU for performing their mandate under the JMC. This is therefore one of our concrete legal and administrative basis to hold LGUs accountable through administrative cases or sanctions. Indicator number 4 focuses on monitoring the manpower quality being employed by our LGUs. Note that one of our integral points is that there is DOH-trained personnel in the screening. Also noteworthy is that a multidisciplinary team must be constituted in the local CBDRPs to handle case management of PWOODs. While primarily a health problem, treatment and aftercare programs would require the expertise of other personnel. Clearly, this is in keeping with the principle of the whole of community approach and the necessity of having experts in government programs. Indicator number 5 measures the coverage of CBDRP programs on the holistic view. The indicators measure the immediate treatment process to aftercare for the individuals and support services to recovering persons who use drugs or RP Woods, including psychosocial support. The DILG CDBRP Symposium is conducted periodically to spur innovation and recognize best practices in the different LGUs. While the JMC now concretizes a standard working model for LGUs to follow, we also shine that spotlight on excellent LGU practices on the CBDRP to inspire our local officials nationwide to find new ways to deliver effective CBDRP responses in their own specific communities. Allow me to go through our CBDRP quarterly report. Next slide. A total of 95,418 individuals nationwide participated in the CBDRP. Of the 17 regions nationwide, it is NCR which has the most number of CBDRP participants. Of course, we have to build on what the JMC can help our local LGUs accomplish as regards the CBDRP. They are the points I personally believe we should build on. First, we need to conduct more symposia and add or encourage more materials from LGU success. Part of the anti-drug campaign success of the national government is the story our LGUs tell of such achievements in the grassroots level. The better story to hear is that people turn away from drugs and allow themselves to be reintegrated in society. It is much more relieving to hear rather than to show someone died because of drug abuse. The national government has always made it a priority to save lives and address the drug problem as a health problem, meaning there's a chance to recover and there is a remedy in place. Second, we need to closely monitor and enforce the provisions of the JMC. This is more on our end and the LGU's end to ensure that we perform our functions as mandated by the law. The JMC, as I mentioned, is also a measure of accountability, and this government has been nothing but stringent in such. Finally, we should learn to adopt the IDIMRIS ADAC RS. It is a step forward, but the national government and the LGU should keep an eye open for new technologies to help improve on accuracy in measurement of performance and functionality. More importantly, new technologies would help in implementing our CBDRP programs. In this age, government innovation and government accountability can live and die by technology as it should, so we can better respond to our people's plight in this stage. With that, I end my presentation. Thank you very much to all of you here in the ISSUP. We hope that we could see each other again in Vienna. On behalf of President Rodrigo Roa Duterte and Secretary Eduardo M. Año, mabuhay po kayong lahat at mabuhay ang Republika ng Pilipinas.
Well, true enough, mabuhay. Mabuhay po kayo sa DILG, mabuhay Usec, RJ, and it will not be Vienna anymore, it will be Dubai in February next year. But before that, in Baguio on June this year. Thank you so much for that wonderful presentation. So now, ladies and gentlemen and friends of ISSUP, we have a break for about 5 minutes. It is not healthy to just keep them in your bladder. So let's take a break. And in the meantime, while we're taking a break, there is a video being presented, I believe. And before that, we would like to call for volunteers to leadership roles in ISSUP. When we were constituted as a board last year, this year we would like to focus more on membership. We would like to invite anyone listening here, especially in the country, who would like to give of themselves their time, talent, and treasure to volunteer for ISSUP. So if anyone here would like to volunteer to make a lasting difference in the lives of others, enable and empower yourself. You see, ISSUP is a veritable trove of learning. ISSUP Global, ISSUP.net is where you can access all types of education modules for you to be trained in serving others, to participate and learn from global network of professionals. As you can see, our audience now is international, from Nepal, from Paraguay, and other countries, and to be part of a movement and journey, and to have access to rich knowledge of resources in the substance use prevention, treatment, and recovery support community. So for those willing to give their time, talent, treasure again, please do send your CV to chit, that's CHIT dot isupphil at gmail.com. That's chit.isophil at gmail.com. Please do send your CVs. Yesterday we received a lot of CVs, and it's going to take a lot of time for us to go through all those who have expressed their willingness to volunteer. We have five basically committees where we believe where you can excel and serve as a member of the helping community. So please do send your CVs. Thank you. And now, is there a video?
We were strangers, starting out on a journey, never dreaming what we'd have to go through. Now here we are, and I'm suddenly standing at the beginning with you.
No one told me I was going to find you. Unexpected, what you did to my heart. When I lost hope, you were there to remind me this is the start. And life is a road and I wanna keep going. Love is a river, I wanna keep flowing. Life is a road, now and forever, wonderful journey. I'll be there when the world stops turning. I'll be there when the storm is through. In the end, I wanna be standing at the beginning with you.
We were strangers on a crazy adventure.
Never dreaming how our dreams would come true. Now here we stand, unafraid of the future. At the beginning with you. And life is a road and I wanna keep going. Love is a river, I wanna keep flowing. Life is a road, now and forever, wonderful journey. I'll be there when the world stops turning. I'll be there when the storm is through. In the end, I wanna be standing at the beginning with you. Knew there was somebody somewhere. Let me love in the dark. Now I know my dream will live on. I've been waiting so long. Nothing's gonna tear us apart. And life is a road and I wanna keep going. Love is a river, I wanna keep flowing. Life is a road, now and forever, wonderful journey. I'll be there when the world stops turning. I'll be there when the storm is through. In the end, I wanna be standing at the beginning with Life is a road and I wanna keep going. Love is a river, I wanna keep going on.
Starting out on a journey.
Life is a road and I wanna keep going. Love is a river, I wanna keep flowing. In the end, I wanna be standing at the beginning.
Hello, everybody. Watching that video really excited me because it says we've just beginning, like our journey has just begun. And I guess we did it right. We started with this pre-conference this January, but the truth is, as like I said, as I was watching the video, I felt so how do you call this, inspired, encouraged, because with the span of how many months, because we just started last year the new board, you see all those pictures in that video that what we have accomplished so far. But I know we will even accomplish more if you come and join us. That's why we are really calling on. We're calling for more volunteers to join ISSUP Philippines. Especially, of course, we're calling for Filipinos to join us for the ISSUP Philippines to volunteer in our different committees. So we promised you from now, from January, we will have a lot of things ready or in store for you. Hope that you will be watching out for all these events that's coming your way for 2001. For 2021. Okay, so at this point, I think we would continue now with our next speakers. Good, so I'd like to say welcome again, everyone from our break. And I will be introducing the next two speakers this morning. First, I would like to introduce Dr. Jose Bienvenido Leabres, the Program Manager of the Department of Health, Dangerous Drugs Abuse Prevention and Treatment Program. That's a DOH-DDAPTP since 2019. Prior to joining the DOH-DDAPTP, Dr. Leabres was the chief in the medical services section of DOH Treatment and Rehabilitation Center in Bicutan and in DOH Treatment and Rehabilitation Center in Tagaytay from 2007 to 2010. He has an extensive education and training in the field of drug treatment and diagnosis. 2015, he took the advanced course in the therapeutic community programs at Thanyarak University, Bangkok, Thailand. And earlier, he had his postgraduate course on in addictions at the Philippine General Hospital, the PDEA. Dr. Leabres continues to take trainings and refresher courses on the diagnosis and management of drug dependence with DOH. Dr. Jose Bienvenido Leabres is a licensed physician of the Philippine Regulatory Commission and a DDB accredited physician for the diagnosis and management of drug dependence. He's also a founding fellow of the Philippine College of Addiction Medicine, that's PCAM. Having Dr. Leabres as our speaker is truly a privilege, since his extensive experience in the field of addiction will surely give us an idea of what we will be learning from him this morning. All right. So our second speaker, the speaker that follows Dr. Leabres, would be Police Brigadier General Ronald Oliver Lee. He has a master's degree in public administration at the National College of Business and Arts. Just last year, between April to October, that's about eight months, right? Police Brigadier General Lee was the director of Integrity and Monitoring Enforcement Group, that's IMEG, and then became the deputy director of the Directorate of Human Resource Doctrine Development, DHRDD. From 2002, as a police chief inspector, he has gone up to the ranks to police senior superintendent in a span of 12 years and became the police brigadier general within 6 years. He has had extensive experience in criminal investigation, being a CID chief to the regional chief of the National Capital Region Police Office. As I read Brigadier General Lee's CV, I realized that the trainings and courses that he has taken over the years is focused on public safety, diplomatic security, criminal investigation, which he took in Japan, Tokyo, Japan. And he even took an executive motorcycling riding course. Brigadier General or Police Brigadier General Lee is a graduate of the Philippine Military Academy and at present the director of the PNP Drug Enforcement Group. At this point, I'd like to call on our speaker, Dr. Jose Bienvenido Leabres, for his presentation on the issues and realities of addiction treatment and behavior health during this very challenging time of the pandemic. Dr. Leabres.
Good afternoon. Thank you very much, Ms. Malin, for that introduction. Good morning, everyone. Good morning in the Philippines. Good afternoon and good evening to other parts of the world. Thank you for allowing me to give a presentation. Is my slides clear and can I be heard properly?
Yes,
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 Bien.
you are.
Yes, sir.
All right. So thank you very much for that. Before I proceed with the changes that were made in this COVID-19 pandemic, the realities that have happened to us, may I give a little backgrounder on what it is with the Department of Health prior to COVID-19 and what are the mandates prior to COVID-19. So actually, drug treatment and rehabilitation way back in the 1970s and 1980s was governed by a previous law called Republic Act 6425. In that law, drug treatment and rehabilitation was under the National Bureau of Investigation and the Philippine National Police. However, because of the development of science, there were changes that had to occur and a new law was created, which is Republic Act 9165 or the Comprehensive Dangerous Drugs Act of 2002. Very important to the Department of Health and to most of us that are here is paragraph 3 of section 2 of RA 9165, and if I may read it, it states that it is declared the policy of the state to provide effective mechanisms or measures to reintegrate into society individuals who have fallen victim to drug abuse or dangerous drug dependence through sustainable programs of treatment and rehabilitation. This law, way back in 2002, gave the Department of Health mandate to take over all the rehabilitation centers in the Philippines, all government-run rehabilitation centers in the Philippines, away from the Philippine National Police and the National Bureau of Investigation. This is the one that gave mandate to the Philippines. Now, from there, we were able to receive around 6 rehabilitation centers, and then to which the Department of Health took over. And for the next 14 years after 2002, we were able to develop another 7 more rehabilitation centers. So we had a total bed capacity of over 4,000 for the whole country, who we have approximately 100 million population. Now, things suddenly changed in 2016 when a new president was elected, President Rodrigo Roa Duterte. He had a very strong anti-illegal drugs campaign. We always see that. It was very controversial. We see our Oplan Tokhang, which was all over the news. We also see alleged extrajudicial killings, which was all over the news. But what other people didn't see was the balance that the anti-illegal drug campaign had. Through the Philippine anti-illegal strategy, it was actually supply reduction and demand reduction. Demand reduction falls very heavily with the Department of Health and our other partner agencies. So starting off with 13 rehabilitation centers, we were able to develop 5 more rehabilitation centers in the past 5 years. So there was an additional 5, increasing our bed capacity to 6,000, and we still have a few more in the pipeline. Likewise, we developed our outpatient facilities and our recovery clinics, which we intend to develop 1 in every province in the country. This is one of the most challenging parts. But more importantly, what one of our speakers have said, Usec Echiverri, was the community-based drug rehabilitation program. We've noted that there are more than 90% of cases that do not need to go into a formal rehabilitation facility. So together with our partner agencies, that's DDB, DILG, DSWD, us from the Department of Health, developed the community-based drug rehabilitation program. So all of these were continuing, all of these were ongoing at the same time. So much is being developed within the country just to address the demand reduction. Then things changed. 2020 came. So when 2020 came, 2019 of December, something was going on in China where a pneumonia case as an unknown etiology or an unknown cause was ongoing. And later on, they found out that it was a novel coronavirus 2019, a new coronavirus which was previously undetected. It was highly virulent. It can transfer from one person to another. And soon enough, it reached the Philippines. The first local case the first case that was detected here in the Philippines was in January 2020, when a foreigner visited the country and fell ill in the country. Unfortunately, this first COVID case in the country was also the first COVID-19 mortality in the country. So the country had to start reacting to all of this. By March 6th, the first local case was found and was confirmed for COVID-19. So the government had to instill measures and quarantine was initiated in March 15 of 2020. So the whole world changed because of coronavirus 2019. Now, when quarantine was initiated, we had to react immediately. Forefront in the response to COVID-19, of course, so one of the forefront agencies would be the Department of Health. So the Department of Health was scrambling everything to ensure that we could contain COVID-19 in the country. So with the quarantine initiated, we also had to protect and ensure that all the services in the demand reduction side of substance use is well protected. We had to make sure that no case could enter our rehabilitation centers. So quarantine was on March 15. By March 17, the Department of Health suspended admissions and group activities in drug abuse treatment and rehabilitation facilities. Very little at that time was known about COVID-19. We had to ensure that all the rehabilitation centers are protected. There's a very high density of population in rehabilitation centers, and it's easy to transmit it from the staff or the patients among themselves. Some of our rehabilitation centers have populations as high as 1,000. And it would be very terrible if COVID-19 would enter one of our facilities. So first, suspend the facilities, make sure that we are well protected against COVID-19. And of course, we have to react accordingly. So we did that temporarily. We suspended our activities and we tried to find out a little more about COVID-19. Now, likewise, the rehabilitation centers, the facilities, and even the staff were also asked to assist in the COVID-19 response. So some of our rehabilitation centers were converted into a temporary treatment and monitoring facility for COVID-19, or what we call TTMF. These were the Davao Rehabilitation Center, Mega Rehabilitation Center, Las Piñas Rehabilitation Center. Other rehabilitation centers who had the facilities were separated. Some were ongoing rehab, while the other half of the facility would be used as a COVID TTMF. Likewise, we had to reassign staff to respond to the COVID-19. So some staff had to be moved around to help out in the COVID-19 response. Now, despite suspension of admissions and group activities, we still continued with the programs and activities of those that are already in the rehabilitation centers and those that are already ongoing in the outpatient programs. However, with the outpatient programs and the community-based rehabilitation programs, there was difficulty of movement because of the quarantine. So there was really a large decrease in the number of cases that were being addressed. Okay. Facility-wise, we had to do a lot of enhancement for infection prevention and control, or IPCs. First was engineering changes. We had to make sure that the areas of activities are well ventilated. There were the necessary hand washing facilities, or if hand washing is not available, there should be supplies for alcohol or any form of disinfectant for the hands. We also had personal protective equipment for both staff and masks for the patient. We also had to ensure that minimum safety standards were being followed. Mask wearing, social distancing, if that is possible during the activities, and also the availability of the mask and the shield so that there would be a decrease in transmission of COVID-19. Furthermore, we had to ensure that the staff are well protected. So we have them tested regularly. All the staff in the rehabilitation centers have to be tested regularly. And being in the medical field, they have, I guess, a little higher than normal level of awareness on how to have infection prevention and control, IPCs, within outside of the rehabilitation centers. We dealt with some of our staff on a rotation basis, 2 weeks, 3 weeks rotation, wherein we had to ensure that everyone who enters the facility are there staying for 2 weeks. They have to be tested prior to entry. They stay in the facility, run all the necessary programs, and then after 2 weeks, a second shift would come in, and so on and so forth. However, despite that, we still had some facilities which sadly COVID-19 has entered. There were 5 facilities that have COVID-19 infections, low-level infections, and would proud to say that they were treated well. The medical treatment was okay, and we have 0 mortalities in our rehabilitation centers. Another thing that we did was the development of the DOH Substance Abuse Helpline 1550. This is a confidential hotline for our patients, for our persons who use drugs, their families, or anybody that would need help with regards to substance abuse. It is confidential, and we ensure that we provide basic counseling, we provide referral to treatment for our substance abuse helpline. Furthermore, our rehab centers had to develop telemedicine and telehealth. So outpatient programs can be done through telemedicine and telehealth. Visitation was run through online, through Viber and Facebook Messenger. So the family could still undergo family therapies, family dialogues. Furthermore, with the help of the WHO, UNICEF, and USAID, we had infection and prevention control refresher courses for all drug abuse treatment and rehabilitation facilities. Now, on the other hand, the central office had to develop online training courses. We used to train and accredit physicians. We train and accredit, we train persons who will be responding for our community-based programs. We had to develop online training courses because we can no longer do face-to-face training courses. All right, so anyway, all right. Now, after a few months in quarantine, quarantine was lifted in June 1 of 2020, so it was downgraded to general community quarantine. We resumed admission of other service in our drug abuse treatment and rehabilitation facilities. However, it has to be selective. There are some criteria that we wanted to do for our rehabilitation centers. Number one is that they have to have the engineering and protocol changes within the facility for infection prevention for IPCs. First is every admission that enters the facility should undergo testing for COVID-19 and a mandatory 14-day quarantine. Before they can quarantine, they must have put up facilities, either temporary or permanent facilities for quarantine prior to entry. They may also network with other facilities of the Department of Health if they need quarantine, if there is quarantine facilities available prior to admission to the facilities in itself. Number two, they have to ensure that all the staff and patients are oriented and follow infection prevention control. Number three, their community has to be within So I have only 3 minutes left. All right, so that was what was going on post-quarantine. Okay, so what are we doing now that it's post-quarantine? Number one is continuing the development of our facilities. We want to develop substance abuse helplines in the different regions of the Philippines. We will continue and develop online training and accreditation of physicians and drug rehabilitation professionals. Also, we would provide information and education campaign materials to our offices, to our units all over the country, and to our stakeholders. We map licensed drug abuse rehabilitation centers. We also support, give technical assistance to other agencies, drug-free workplace programs, and also the provision of special prescriptions for regulated drugs. Okay, to end in finality, I would just like to introduce to everyone the DOH Substance Abuse Helpline 1550. I've discussed this in detail a while ago. It is a confidential helpline for our persons who use drugs and for their families if they need help with regards to substance abuse. We give brief counseling. We also give referrals and whatever needs they have. We will treat it confidentially and we will never document it. Right. So thank you very much, and I hope everybody has a nice day.
Thank you so much, sir. And we are very happy to hear of the various innovations in reaction to the pandemic. Congratulations po as you continue the changes that you are undertaking. And I hope you do stay. There are a lot of questions lined up for all our panelists for this morning. Ewan ko ba, baka mas mahaba pa sa mga presentation nyo.
We'll try to address them all.
Salamat ulit. And
Okay,
yes, sir. And now for the Philippine National Police. Unfortunately, our invited panelist is not here, but he, in his absence, he will be represented by the person who is really in charge under his department. And let me read her CV. It is very extensive, so please bear with me. Well, first of all, she's a female graduate of the Philippine National Academy, the National Police Academy in 2000, belonging to PNPA class Magilas, and continuing her education in master's degree in government management and graduate studies with honors at the Philippine Public Safety College and Pamantasan ng Luzon ng Manila. And what is significant also about our representative panelist is that she has been adjudged twice by the Quezon City Police Department as Police Woman of the Year. How's that? Now, she is the first female regional training director of the Regional Training Center in Lucena City. And without further ado, I think her presentation would bear much on our learning today. We'd like to welcome our officer in charge of the Demand Reduction and Education Division, Police Lieutenant Colonel Cherylou Balanay Donato. Magandang umaga po. Good morning to everyone.
Good morning, Sir Tito. Good morning, everyone. Thank you for that kind introduction. So, to the International Society of Substance Use Prevention and Treatment Professionals Philippines chapter, headed by President and Chair, Ms. Teresita C. Castillo, ma'am, the officers, men and women of ISSUP Philippines, a pleasant morning to all of you. Firstly, in behalf of our Director, PNP Drug Enforcement Group, Police Brigadier General Ronald Echiverri, I would like to thank the ISSUP Philippines for inviting the Philippine National Police Drug Enforcement Group to become part of your pre-conference meeting. So I'll go now directly to our presentation. Next slide, please. So the sequence of my presentations is as follows. I'll be giving the true picture of the drugs and current realities, the anti-illegal drug accomplishments, and of course, the assessment and updates. Next. So the advent of the pandemic has brought numerous challenges, both globally and domestically. So the number of people infected with the virus continues to rise exponentially, and the imposition of certain quarantine restrictions has wreaked havoc on our country's economy. So despite these challenges, our country's problem on illegal drugs has persisted. Illegal drug traffickers have found ingenious ways to ply their trade and maintain criminal enterprise. Recent technology advances were taken as an opportunity by this unscrupulous group of individuals and even managed to use courier services, money remittance centers, electronic app applications, among others, to facilitate their illegal transactions. So our most abused illegal drugs in the country, based on records, is still the methamphetamine hydrochloride, or locally known as the shabu, averaging an amount of 6,800 pesos per gram, followed by the marijuana being cultivated in high altitude or mountainous area of the country, giving a standard drug price of 120 pesos per gram. And of course, now the ecstasy or the party drugs affecting the affluent members of the society, having its standard drug price of 1,700 pesos per tablet. And some of our abused drugs, like the inhalants. Next. Another new variety of drug that has been introduced in the market recently in the market is the cannabis indica, or the kush. It is a hybrid type of marijuana, and this was intercepted from the Clark International Airport last August 2020, wherein it was wrapped in a parcel of clothing and coffee that came from the US, going into a consignee, person consignee from Target. Next, ma'am. So for our drug syndicates that proliferates in the country, still the identified drug group that dominates the market is the Chinese drug syndicate, who facilitates the production, manufacturing, and bulk smuggling of illegal drugs. Also, we identify the presence of the African drug syndicate, or the African ADS, responsible for the illegal smuggling through airports, who are using drug couriers and swallowers. Then we have also the local drug syndicates, who are also responsible for the conduct of drug trafficking activities within their territorial jurisdiction. Next. So because of the intensified anti-illegal drug campaigns of the national government, transnational drug syndicates are now shifting also their method of operations from manufacturing or maintenance of clandestine meth laboratories to importation and smuggling of illegal drugs through the airport, seaport, mail and parcel services, and vast coastlines of the country. So before, the drug syndicates preferred destinations where large Filipino communities can be located, like the countries of US, Australia, Middle East. But now the incidence of importation of party drugs, particularly the ecstasy or the MDMA from Europe, continues to soar and penetrate our soils through postal packages that is concealed and labeled as bag of candies and packs of coffee beans. Next, ma'am. So the recent modus is they are using a bank-to-bank transactions as their mode of payment. So the drug syndicate will establish a legitimate bank account that can be used as their portals of paying the item. The broker will then negotiate with the prices before paying it to the said bank account. Then it will be deposited. Then the drug syndicate will then check it to the bank if the payment has been deposited already, and they will allow, and then they will now coincide with the information of picking up, or they have this picking up area. Thus, the online selling of illegal drugs became a problem nowadays. And because of that pandemic, the use of taxis and the transport network vehicle services, or the TNVS, as couriers has also been monitored by the authorities. Our organization, the PNP organization, has strengthened our interagency coordination with the Anti-Money Laundering Council in combating this illegal drug trafficking by going after the supply chain and limiting its monetary capacity. Next, ma'am. So for our operational accomplishments, next please. Covering the period from March 17 to December 31 of 2020, previous slide please. The PNP Drug Enforcement Group was able to conduct 66 anti-illegal drug operations that resulted in the arrest of 93 drug personalities and death of 11 drug suspects and confiscation of various kinds of prohibited drugs amounting to almost 9.3 billion pesos based on the standard drug price set by the Dangerous Drugs Board. Next. So comparing the data of March 17 to December 31 of year 2020 versus the same period of 2019, there is a huge increase in the seizure of illegal drugs that was recorded. The increase in the confiscation is more or less 6 billion pesos worth of illegal drugs, or 181.8% increase. Next month. So based on the comparative data of the PNP DILG anti-illegal drug accomplishments covering the period from March 17 to December 31 of 2019 and 2020, the 181.8% increase of amount of confiscated illegal drugs shows that drug traffickers are taking advantage of our situation now, despite of the implementation of community quarantines, lockdowns, and intense checkpoints in the early stage of the pandemic. The drug traffickers is still able to manage the traffic, to traffic large volumes of illegal drugs. And reports from our operatives in the different special operations unit, they noticed that there is an increase in the street value on illegal drugs, specifically the shabu. This could be the result of the intensified checkpoints on every streets and barangays due to community quarantines or community lockdowns. Next, ma'am. And despite the COVID-19 pandemic, the PNP will continuously perform our mandated functions, our mission and vision, to achieve a drug-free Philippines. So further, our minimum health standards and existing protocols on COVID-19 will be strictly observed by our organization and ensure that the welfare of the personnel are taken into consideration also during the conduct of our anti-illegal drug operations. Next. Also, part of our assessment is that drug syndicates quickly adapted themselves to the new normal situation from traditional to a highly discrete and compartmentalized transnational drug trafficking. Thus, we continuously conduct our illegal drug trade despite quarantine restrictions during the pandemic. Next. Persistent round-the-clock conduct of anti-illegal drug operations by the PNP, as evidenced by a series of notable arrests and accomplishments, the unfortunate armed encounters with illegal drug trades, and of course, the filing of appropriate cases in court with the aid of our partners in the National Prosecution Services, the Department of Justice, with the strict implementation of the anti-drug campaign in the airports and seaports. That will be also our focus by the PNP organization and will also remain to be a challenge to our government. Next, ma'am. With this assessment, there's this continuous cooperation and timely coordination with the PDEA as our lead agency on this war on drugs and other drug units that will surely result into a more interdiction operations in the country. And of course, not to mention our continuous collaboration with our stakeholders and coordination with our non-government organizations like the Drug Free World, our Drug Free Philippines, who have been very active in our demand reduction campaign. Next, okay. I think that would be all, ma'am, for the presentation. Thank you and good morning, everyone.
Thank you very much, Police Lieutenant Colonel Cherylou. And if you please may please open your video or your camera again, including all our distinguished panelists, Undersecretary RJ Echiverri, Undersecretary Benji, Dr. Leabres, yes, there. Wow. My partner Jay is here. You can call me Mel just for this period. Okay, welcome to the
Sorry for
Q&A.
that again.
We're gonna be opening the questions now, the question period. Jay asked me to start, and this is the first question. I don't know who can answer this. Do we have data on plea bargainers who reoffended? I suppose this means who were remanded back to the jail. Can somebody answer this question, please? This is from Ronald Rivera. Oh no, Jay, you're supposed to ask this.
Hello, Tito.
Yes, sir.
Yeah, actually, the Supreme Court is now trying to establish the database for the plea bargainers. Ang alam ko, so far, we have communicated with the Office of the Court Administrator regarding that particular concern. No? It is important for us to know whether or not the person has availed of the plea bargaining provision for the second time. No, if you recall, we mentioned that second-time plea bargainers are actually not allowed, under the jurisprudence, under existing jurisprudence. So
Yes.
unfortunately, we're still trying to develop the system for that, Tito.
Thank you. Thank you. I hope Ronald Rivera, you're from Davao, I suppose. I understand. Next question, Jay.
Can I interject? With what
Oh, yes, yes, please. Yes, please.
Yes, Tito, just go on. I can see the question box, Tito. I rejoined.
Yes,
Yeah, can
yes,
I,
Undersecretary.
yeah, can I, yeah. Of course, we are also looking into that, no. But the plea bargaining option given by the court for at least these voluntary surrenderers and those who are allowed to get that benefit. Alongside with that, there should still be a prepared CBDRP program that would,
Yes,
that would accept them.
yes.
And that's why it's really imperative that LGUs nearby, most especially nearby BJMP facilities, should be ready to take, if not take them, but some of the areas that would be able to give them that program. Otherwise, we will be having difficulty of addressing it. That's why we issued in the DILG as well that BJMP should have its own community-based drug rehab program inside the facility. But again, due to lack of funding and the congestion issue still is existing in the institutions, we opt to ask the local government to help. But this is under work still. And hopefully by the time the Supreme Court would finally decide to implement it soon, or if it's being implemented now, we could be able, we in the local governments, together with DOH, TDB, and PNP, would be able to implement it fully. That's why we really promote the CBDRP program. even in times of pandemic.
Thank you. Thank you for that. Thank you for that. And now for another question. I think this is also for you, Usec RJ. Do you conduct follow-up monitoring for those barangays who are already declared drug-free?
In line with the barangay drug clearing operations of PDEA right now, or a policy which I think Director General Wilkins Villanueva is now implementing as a policy, we are now integrating that act inside the CBDRP program. Because again, if it is useless not to monitor these people, because what's the basis for barangay drug clearing if we would not be able to monitor whether or not these people have relapsed,
Yes.
or have they continued with their treatment or have really rehabilitated. That is one of the roles of the barangays and the mayors, no, and the city municipalities, to closely monitor these patients and their constituents as well. Because again, what is a clear basis for barangay drug clearing were it not for this program? And I agree with you. The answer is yes. There is a monitoring system in place and instituted in the system.
Thank you. Thank you for that reply. And this one is from a good friend. He's based in Baguio. It's a long question, but I will just ask it in one sentence. With regards to that recent case in Cebu, where a client died inside a treatment facility, what government body would be in charge or would have jurisdiction on that case? And if any of our panelists today are handling it, are you free to discuss it? This is for anyone who could reply to this question. Thank you.
Bien, siguro I'll address that question, Bien.
Oo nga, Bien, siya yan.
Si Usec Benji daw.
No, we already spoke with the Bureau of Health Facilities and Services Director Attorney Nick Lutero. He's already looking into it. No, in the first place, the facility in question is unaccredited facility. No, 5 personnel of that facility were already charged. No, with I think murder. The charge was murder. And I was also communicating with the president of ISSUP, si Ate Chit, no? We're discussing on whether or not we should also revoke the certification of the staff who were involved in the incident. So we're looking into it, and I already called up the Anti-Drug Abuse Council head in that particular city, and we're discussing it, and for sure those who are responsible will answer to the death of that particular client.
May I add to that?
Yeah, please, Bien.
Okay. Generalizing everything, the one that is responsible for the operations and the monitoring of facilities, both, well, I guess accredited and unaccredited, is the Department of Health Bureau, called the HFSRB, Health Facilities and Services Regulatory Bureau, HFSRB. They would look into, and for the case of rehabilitation centers, they would look into and monitor the rehabilitation centers, recommend closures to the DDB, to which the PDEA and other law enforcement agencies, upon orders coming from the DDB, will act on. That's the generalization of it. But it also has coverage from the law enforcement authority. In the case of a mortality, or in the case of a death in the facility, a non-medical death, non-illness related death, a suspicious death, then it is covered by the law enforcement authorities also. And the appropriate charges can be made by the law enforcement agencies. Jurisdiction na nila yon. As far as accreditation and closure of the rehab, ano po yan, joint po yan from the Department of Health all the way to DDB, PDEA, and the other law enforcement agencies. And the removal of accreditation of the staff from the DOH, DOH naman na po yun. So it really encompassing everything based on the appropriate, of course, it has to undergo appropriate investigation and assessment.
Thank you. Thank you for that. I hope, Keith, your question was answered, but I'd like to make a follow-up on that because there are also, I think there are more non-accredited treatment facilities. So would that be falling also under the Department of Health, Dr. Leabres?
Yes, that is correct. That would fall under the Department of Health. Pero ganito, no? We're not there. Well, if they're not accredited, we're not there to immediately close them. We would rather help them achieve the minimum level of services, minimum accreditation. Hindi naman basta-basta. We're not just there to just suddenly come there and then we're shutting you down. No. First, we give them an opportunity to achieve a minimum level of services. If they achieve that minimum level of services, then they will be given an accreditation and would be very happy. They would have all the benefits and protections of the law. But if they fail to achieve a certain level of minimum services, then they would be subjected to cease and desist orders through the usual processes.
In line with what Dr. Ben has mentioned, I will also look into the release of permits, by the LGUs, because again, they cannot just operate without any permits coming from the mayor, and they should be properly monitored. We will issue a memo on that so that these kinds of things will be prevented and would hopefully help the DOH to implement their policy.
Okay.
Siguro Tito, in line with this discussion, let me inform everyone, and maybe to seek the help of everyone to report unaccredited treatment and rehab centers. As mentioned by Bien, the intention is really to help them secure that accreditation, but also to monitor them while they are still complying with the accreditation process. We don't know what will happen, like in the case of this facility. And again, I'm happy with the move of DILG to issue a memorandum regarding this. For the information of everyone, some of those unaccredited facilities are operating using only permits coming from the local government units. So again, under the law, it should be an accreditation coming from the Department of Health. So help us, report to us the unaccredited facilities that you know of operating in your areas. Thank you, Tito.
Thank you. I'd like to make my own follow-up to that. Our outpatient facility was accredited before the pandemic, and now that there is this isolation and how will a facility, especially a residential treatment facility, get its accreditation in this period of the pandemic? Is there already, or is there could you post a site or a contact person where these facilities may now be assisted to be accredited by the Department of Health?
We have not changed the accreditation requirements for all the facilities, but we did give guidelines for them to follow on how to implement infection prevention and control. We want them to continue performing their services, continue giving them services, but we want them to enhance it. Did not have an effect on the licensing as of this time. Perhaps in the future, but we look forward also to having COVID-19 out of our system, out of the country, and out of the world. Hopefully, a vaccine will be coming soon. There's already vaccines all over the world, and pretty soon it will come to our country. And hopefully, we can come back to our normal. But what we learned from the IPCs can still be utilized all throughout, even after COVID. Sana mawala na dito si COVID. Lapit na yan.
Okay, okay. So if the inspectors come from Manila, so what will happen now is the inspectors will come from the region. Am I correct?
The first inspection usually is from Manila. The subsequent inspections are from the region.
Okay. So what will happen now with the pandemic? The Manila will also send to region.
Not at this time. Not at this time.
Thank you. The next question, Jay, could you see the questions already? Oh, my partner is quiet.
Yes,
For Dr. Ben.
I think my audio, I hope my signal is okay. No, no, I have a problem with my signal and I hope it's okay. But anyway, I have here a question from, actually it's a friend from Davao. He's very much active and this is in relation with the plea bargaining. I think this is for the ILG. No, I believe the HMP is under your department. So the question here is, what's the status of the single carpeta system? What is the relevance of single carpeta system in determining previous criminal cases of those applying for plea bargain? I think this is for Usec, RJ.
I think this question suits the parole and parole office of the Department of Justice.
Okay.
Yes.
And the DILG has no jurisdiction over the matter.
Okay. Thank you for that. This is also another question in regards to CBDRP and its implementation. How far are we now? And how do we rate the effectiveness as a whole?
Thank you for that. Actually, before it was really just an idea that is trying to be implemented. And eventually we saw after a year, there might be organized, but we have no way of checking whether it is really functional. So it's organized, but we really don't know how to say that it is really functional and effective. That is why DOH, DDB, and of course the ILG and the SWD came up with these indicators. What are these indicators? It is a step-by-step way of checking of the accountability and deliverables of each LGUs to do. So if ever you will do this, more or less, your CBDRP will be effective and functional. Because that is, I think, the guidance which the LGUs are asking from us. And DOH has managed to draft that together with DDB. Now it is through a Dangerous Drugs Board regulation. So medyo permanent na po siya. And that is now what we are now implementing by assessing first the LGUs, the ILG assessing the LGU's performance, checking whether they can do it. If they cannot do it, then we capacitate them, and then eventually monitor them again if they are following the indicators as well. And then eventually we will also give awards to those who are complying and are excellently performing in following the indicators. So hopefully with this policy that we have just drafted and now being implemented, we could fully implement it. But going further, we really would want to include this in the Anti-Drug Abuse Council law. Why? Because we are afraid if the next administration comes in and it would not be Duterte anymore, it might not be a policy anymore. And since it's just something that is a loose program, it could not be implemented. Whereas if it's a law, it serves as a permanent institutionalized program to all, regardless whoever sits as the next president. In short, we really need this policy to be institutionalized under the Anti-Drug Abuse Council, because the Anti-Drug Abuse Councils will implement the CBDRP program and eventually make it effective. So hopefully we could pass soon the ADAC law and make it permanent. Because when I filed cases against mayors and barangays for not making their ADAC functional, that goes along with CBDRP. winidraw o kumbaga dinismiss ng ombudsman some. Why? Because there's no legal basis. Because the creation of such policy was just a memorandum circular by DILG. It's not permanent. There's no sanction at all. So ngayon yung mga mayor at governor at barangay, ganun lang pala kababaw, walang basis. They could always violate it. They have the choice not to implement it. So yun yung fear namin. Hopefully it becomes a law soon so that it would be mandatory. Hindi siya parang, advice lang. Because at this point in time, what we need are serious efforts under anti-illegal drugs. So, sayang naman yung campaign natin for the past 4 years, no? Sayang, no? Most likely what ISSUP is also doing prior to the assumption of the president, andyan na yung ISSUP gumagalaw na kayo no? And I hope it's helping ISSUP further, no? Enhance its program and hopefully create a drug-free society. Because if we could at least address this, 60% ng mga nakakulong sa BGMP, puro anti-legal drug drug program, drug issues cases yan Pag na-address natin ng drugs, karamihan na nasa BGMP, ma-address rin. Because majority of those who are inmates are drug-related cases rin. So hopefully we could address this soon. And that is the indicators which I have discussed a while ago.
Yes, thank you for that, Usec.
Yeah. Thank you for that, Usec.
Last question dito, I think.
We have we're already pressed for time, but one last question from you, Jay.
Yes, I think this is in connection with what Usec has mentioned. I think this is just a yes or no for DDB. This is from Ronaldo Rivera again. No, for DDB, meron na, I will just read the questions, but it is in Tagalog. No, meron na po bang nakasuhan ng Section 32 or liability of persons not following DDB regulation? At kung wala pa, ibig sabihin lahat ay sumusunod sa lahat ng DDB regulation.
Actually, yes, we have filed cases against two particular persons. No, I think LGU somewhere in. I will not mention specifics, but LGUs in Mindanao and one in Visayas. No, so far the cases are still ongoing. It's non-compliance to board regulations, and therefore under RA 9165 Section 32, they are liable. No, so we're waiting for jurisprudence regarding this matter. Hopefully the cases will prosper. There are two cases.
For DILG, in line with what Usec Benji has mentioned, remember the narco list, which the president has mentioned, the narco politicians. When we assessed majority of them have failed to create a functional anti-drug abuse council or organized. Pursuant to that, because there's a joint memorandum circular between DDB and DILG in the creation of the anti-drug abuse council, majority of those in the narco politicians list, which the president has mentioned, we have filed against them in the ombudsman for failure to comply with the DDB regulation. And that is more or less, if I'm not mistaken, 400. That goes along with barangays, municipalities, provinces, and cities.
Okay, thank you so much. As we mentioned earlier, this is the national conference covering. We also have here a message to all of the panelists from a United States Senator from Illinois, Matty Hunter. She said the presentation were very informative. So thank you for that comment. Last one sentence from each of the panelists. What silver lining can you identify from your department in the midst of the pandemic with regards to drug demand reduction? In one sentence. Thank you.
Well, let me start. Everything's still moving forward. I think that's the best news so far.
for the DILG, DDE, and the rest, no, we hope that the Anti-Drug Abuse Council law will be passed soon, so that all that we are trying to do right now will be fully institutionalized. That whoever sits as the next president will just benefit from the system that we have managed to do.
Thank you.
Very good.
From the Department of Health, the new innovations that we have, telehealth, telemedicine, online training programs will be here to stay, and it will be reaching far more for all of us, and hopefully more services for everyone.
From the PNP?
Yes, sir. From the Philippine National Police, we are looking forward to strengthen our collaboration and cooperation with other departments like Department of Education, since we are also dealing with the drug demand reduction in the youth sector, sir.
Thank
We are
you.
pressed for time. We now go for the Rapporteur Jay. Take it away.
Yes, thank you so
Panelists,
much.
please stay.
Thank you so much, Usec, Benji, Doc Bien, and Usec RJ, and Ma'am Cherylou. Okay, in as much as we would like to cater everyone's questions, we'll put a halt in it, and let's proceed to our next speaker for reflection and summary. Our next speaker is Ms. Joanne Emeline A. de Belen, Senior National Program Officer, UNODC, Philippines. Ms. Joanne de Belen works as Senior National Program Officer with the UNODC Program Office in the Philippines. Her portfolio includes project development, monitoring, and evaluation for all UNODC programs, as well as drug policy. She also manages the support to COVID-19 infection management for people in prison and persons with drug use disorders, and is helping in the research on anti-corruption in the BARMM, as well as Philippine casinos and anti-money laundering. Before UNODC, she was managing director for Mindanao at the Development Academy in the Philippines and worked closely with BARMM on organizational capacity development. She is a development management professional with an experience of over 2 decades in designing, implementing, evaluating, and mobilizing resources for programs. She spent 10 years in Indonesia as country director for an international NGO, initially managing its Indian Ocean tsunami disaster response in Aceh and Nias, and then leading in the country's programs. Her work on drugs and health started with the research on community-based drug treatment and rehabilitation modalities of Region 4B. She co-convened the Asian Center for Drug Policy in 2018 and was part of a team that designed and won the bid for the 5-year, $15 million project on drug demand reduction, Renew Health. Ms. de Belen is a graduate of BS Psychology and Master in Management, major in Development Management, graduate of the University of the Philippines, and is currently working towards her doctorate in public administration, also at UP. So, Ms. Joanne, the floor is yours now.
Thank you very much for that introduction. And let me share. Okay, can you see my screen now?
Yes, ma'am.
Yes, we can.
The presentation,
Yes,
you can see the presentation. All right.
Yes.
All right. So, okay, let me. I'm sorry. Let me just take care of. Okay. So thank you very much to the esteemed presenters for sharing to us the challenges faced in the delivery of evidence-based drug treatment and care services to people who use drugs. Maraming salamat to Undersecretary Benji Reyes, DG Wilkins,
Dr. Leabres, Usec RJ Echiverri, and Colonel Donato. My task today is to present a summary and reflections on the different presentations. And what I did was listen and watch out for common threads, both among that which has been articulated as well as the song beneath the words. A common thread that we found, that we've been seeing, is that COVID-19 has thrown our world upside down and inside out. And as Usec Benjamin Reyes says, it completely changed the way we do things. So the way I felt I can summarize the common threads is through presenting the pre-COVID situation, which all of the presenters gave, and then the challenges that were presented by the coronavirus and the community quarantines, and then how the government and its partners fielded adaptive responses. So let's start with the pre-COVID. In the pre-COVID situation, transnational drug syndicates have already penetrated the Philippines many years ago pa. And this was a challenge that law enforcers faced even pre-COVID. There was already a slow change in the drug of choice, not just in the Philippines, but globally. And Southeast Asia and the Philippines was quickly and steadily shifting to methamphetamine or shabu, which flooded the illicit drug market in recent years. Also, the drug problem was already an adaptive challenge, especially after 2016, when the drug campaign was intensified through Oplan Double Barrel or Oplan Tokhang. As Usec Echiverri cited, in 2016, there were all of a sudden 1.8 million surrenderees, 90% of which were assessed to have only mild risk to drug abuse. This sudden increase shocked and overloaded the Philippine health systems, particularly the drug treatment and rehabilitation centers. So the concerned agencies had to work double time to bring up the capacity of its systems and processes. At that time, there was already the Philippine Anti-Drug Strategy, or the PADS. It was already in place and was in the process of being revised or improved. It was the PADS was the government's, is the government's balanced and holistic strategy to respond to the drug problem in the Philippines. And then the community-based drug rehabilitation program was formulated already pre-COVID to address the challenges of the increased drug campaign. It was formulated, tested, rolled out, improved, tested again, etc. All of these are being adaptive response to the drug problem. Among all of these, the drug demand reduction response was a task mostly for the DOH. The LGU, being the implementer of the CBDRP, also needed capacity building. This was done through strengthening the operations of CBDRP among the LGUs, including developing standards that Usec Echiverri was describing and that the DOH had formulated, standards, incentives, and sanctions. And then came the COVID. So the COVID gave the government's drug campaign another layer of challenges on top of what it has already been facing. It also gave the clients of the system, the PWOODs and their families and their communities, less access to the services that they desperately need. In the COVID, wait, let me just pause a little bit there. Okay, in the COVID situation, the drug problem still continues. It didn't stop, it didn't wane, it continues. Even at an shall we say, more intensified level. The drug syndicates, both regionally and in the Philippines, were very innovative. They decentralized their organization. They reverted to shipside smuggling, the use of couriers and e-cash and bank-to-bank transactions. So they quickly adapted to the situation. In addition, during the COVID and even before, there's an increased supply and demand for shabu. Drug price increased, the purity was maintained. And there was a suspension of CBDR services. Another problem or challenge is the high population density in the rehab centers, in prisons and jails, as well as the temporary suspension of activities. And all of this was because some of the facilities and staff were diverted to the COVID response. Now, what was the government's adaptive responses? One is the increased engagement and linkages with citizens, stakeholders, and partners, and especially the LGU. The second is policies were created or pushed on streamlining criminal justice processes to release PDLs. The use of ITC, shifting to online platforms for learning, coordination, engagement, and engineering changes for infection prevention and control in facilities. There's also the substance abuse helpline of the DOH, and as well as the continuation of law enforcement activities, seizures, monitoring, and destruction. All in all, the song beneath the words is really harmonizing policies and programs so that we do a whole of nation approach, solutions to the drug problem. Let me go to the next slide. And just to mention the silver linings of the whole thing is, as Usec Bench says, everything's still moving forward. So that's a good indicator, not just the magnitude of the response, but the direction of the response. So moving forward is good. There's the ADAC law and pushes for institutionalization of policies. New innovations, as Doc Bien has said, the new innovations are here to stay. And you can see in the slide a quote from Heifetz, who says, yesterday's adaptations are today's routines. In the same manner, our today's adaptations will be tomorrow's routines. And the strengthening of collaboration. And I will quote from Usec Bench Reyes, as well as Usec Echiverri and Doc Bien, to keep the drug campaign top of mind amid and beyond the COVID-19. That is their call to action. And I included the helpline here, so please use it or recommend it. Thank you very much.
Thank you. Thank you very much, Ms. Joanne. Very well put, whole of nation approach to the drug menace. Chit, we
Chit
can't
is
hear you,
muted.
Chit. You're muted, Paul.
Okay, I'm sorry. Thank you, Joanne, for that very comprehensive summary and reflections. I appreciate your thoughts about it. At this point, may we call on all the presenters to please turn on your
cameras.
Your cameras. There. Okay, because we have our social distancing protocols. We will present to you virtually our token of appreciation through our virtual certificate. So this certificate of appreciation is presented to all of you. We start, of course, with Dr. Usec Benjamin Reyes, Usec RJ Echiverri, DG Wilkins.
DG Wilkins, yes.
Dr. Bien Leabres, thank you. And of course, Colonel Cherylou Donato. And of course, Joanne Emeline de Belen. Thank you all. So this is the certificate of appreciation is hereby presented to you in grateful acknowledgement and appreciation for having served as a resource speaker during our ISSUP Philippines pre-conference event, Issues and Realities of Addiction and Behavioral Health on a National Perspective. given January 28, 2021, Philippines. Signed, yours truly, as Chair and President of ISSUP, and Tito Noel A. Mora as Board Secretary of ISSUP. We will email this to you, and please give us your personal addresses so we can give you Lala Move delivery. Okay, so thank you very much. Susan, would you like to add anything to our speakers?
Yes, maraming salamat po. Really, personally, and from what we've seen po sa mga comments ng attendees, it has really been a most impressive and really quite encouraging information on how we are making progress on Philippine ground, coming from all of you. So it was, you sounded very engaged in what you do, very passionate, and certainly that rubs off on all of us. Thank you, Paul, for the inspiration. Maybe we can already stop the share screen so that we can have a group photo op with our speakers, Chief.
Yes, I would like to also request Tito, Jay, Malin, and everybody to
BOT.
Please, everyone stay on for some time. Tito there, everyone accounted for. Okay. Smile. Okay, one more. Okay, just follow up lang, pahabol. Okay. This is a very, like what we said, very informative and substantive session, especially coming from the different sectors of government. Contrary to what we normally hear, like what I said earlier, there's a lot of negative, publicity or fake news about what the government really does. But hearing from everyone exactly what is being done already, okay, I think there's really hope and good. What Usec mentioned, Usec Benji, is we're really moving forward, and I think we all have to really keep an open mind and be a little more positive and do our share in trying to address this problem that we have. So thank you on behalf of course, ISSUP Philippines. Thank you all for being here today. Thank you. Tito, please stay on. Okay. Thank you.
It is so hard to close this. The
Yes.
chat box is full of, there was even one mention here that, aren't we supposed to end at 1 o'clock? I suppose it is very good to see and hear from government that many of the inputs from civil society like ISSUP, it is already in your programs. And as mentioned by my seatmate in Vienna, Usec RJ, I'm very, very happy. We are very, very happy for a listening government. That is something that we are very proud to have here. So we'd like to close the second day of our pre-conference, and we hope that you will also, and maybe your EAs or representatives can join in for tomorrow, where now the frontliners of recovery will be present. And once again, we would like to invite you all for your time, talent, and treasure to volunteer for ISSUP Philippines. You can email your CVs to chit.isupphil@gmail.com. And tomorrow, we will have our speakers starting from Mayor Vico Soto of Pasig, from UNODC, Giovanna Campello on prevention, Therese Castillo from the Colombo Plan Drug Advisory Program, Miriam Kwe from the Philippine, what is that PRC? Philippine Regulation
Commission.
I'm very bad at abbreviations. And Dr. Hilda Gail Gomez, and a family member in recovery. So from Cagayan de Oro, Jay from Davao, Chit and Susan from Laguna, Malin from Makati, and to all of you who gave your time, talent, and treasure for this plenary, daghang salamat. Thank you very much. Mayong udto sa tanan.
Thank you. Thank you, everyone. Thank you.
Thank you.
Thank you, Olivia. Thank you.
Thank you, everyone.
Olivia and Kat.
Thank
Thank
you.
you. Good day,
Good talk.
everyone.
Thank you very
Thank you.
much. Thank you for the
Thank
See
you.
you
kind words.
tomorrow. Okay, we'll see
Thank
you
you, ma'am.
tomorrow.
Thank
Thank
you,
you.
everyone.